Thank you for staying with us. Joining me now from the Lanark Leeds Grenville Addictions and Mental Health, I'm talking with the clinical manager of professional practice and education, happens to be Chris Curry. Chris, welcome.
Thank you so much, Doreen. Great to see you.
What is stress?
What is stress?
Yes.
Stress is something that we're definitely all very used to feeling. Absolutely. I think the pandemic, money problems has all really made stress a part of, unfortunately, most of our lives.
Yes.
Absolutely.
Yes.
Mm-hmm.
But some types of stress are good, though, are they? Is it not?
Yeah. So stress is it can be a signal that something needs to change in your life. So if something is consistently stressing you out, finances, relationships, those kinds of things. So stress can be a signal.
Yes.
But when it's constant, it kind of defeats the purpose anymore. It's not really signaling you to do anything about it. It becomes overwhelming, all-encompassing, and really interferes with your daily functioning for sure.
I see. Okay. Are there different types of stress?
There are different types of stress. So workplace stress is a very common one that we're seeing right now.
That's a big one now, isn't it?
That's a huge one.
Yes.
So once again, with the COVID-19 pandemic, healthcare staff in particular were overworked, stretched very thin. So workplace stress has skyrocketed actually in the past couple years. And I actually read some recent research that around 66% of nurses right now are reporting signs of burnout, and about 30% of just average worker are now reporting signs of burnout as well. So it's affecting everybody, but healthcare workers are definitely much more affected than others, just due to the staffing crunches, due to the increasing acuity of clients that people are seeing. Yeah, it's becoming very, very difficult for a lot of professionals.
Yeah, it's understandable. It really, really is. So could there be physical stress on the body?
Yeah, physical stress. So any kind of injury, is going to cause physical stress. And then when you have any kind of physical stress, that can also add to your emotional stress as well. So you often hear when someone has an injury which prevents them from going to work, then they might develop even mental health symptoms along with that.
Okay.
So physical stress can unfortunately lead to emotional stress down the line as well.
Wow, wow. So it really, really is something that I think we took for granted years ago, but is now, it's being addressed.
Yeah, now it's at the forefront of everyone's conversations, and that's a good thing in a way. We're a lot more comfortable talking about it,
Right.
especially workplace stress. There's been a recent push to increase what we call psychological safety in the workplace. So that essentially means that if a workplace is psychologically safe, it means the employees are comfortable to bring concerns to their management team and feel that they're not going to be disciplined for those, and that those concerns will be addressed and listened to.
Yes.
But if an employee doesn't have that psychological safety, they're not going to reach out for help, and then the stress just compounds and compounds, which can lead to burnout, which can lead to going off of work and those kinds of things. So things are getting better. It is more talkable, but just making it talkable does not, unfortunately, eliminate the problem.
No, it doesn't. And if well, you just gave two examples, and it's not a win-win situation in your second example, because you can't talk to anyone within management, and the feelings, as you say, the emotional feelings are, well, what am I going to do? I have no one that I can talk with.
Exactly.
And then it just builds. They end up taking time off. The production isn't there, so the employer is losing. The employee, unfortunately, is off. So they're so it's is it worth it? Is it worth it in the end? No, it's not, right?
No, definitely not.
No.
And yeah, everybody loses. The employers are losing billions of dollars a year in lost productivity. Families are affected. Many leaves from work now are due to mental health challenges, and stress in the workplace is a leading cause of that. So I think we need to realize, like, for a full-time job, people are spending 40 hours of their week in this environment, and if that's a stressful environment, that's very hard to deal with, and that's going to escape into other areas of your life as well. So employers really need to step up and realize that employee well-being, it really affects everything. And if anything you can do to make employees feel safe and comfortable and heard and validated, is gonna help out for everybody down the road.
Those are the companies that are going to succeed.
Exactly.
Because
yeah.
they're not losing the financial aspect of it. So are we our worst enemy when it comes to stress?
We can be. Often when we're stressed, we get in kind of circular thinking where it's hard to find a way out. And so we start thinking in kind of in a doom and gloom sort of way. So it's always good to get someone outside of the situation to get their perspective. So a therapist, a counselor, of something like that, to give you a different look at the situation. Because if you're just in it 24 hours a day and you're not talking to anybody, it's just going to get worse and worse and worse. So talking about it is key, either with a family member or with a professional, but you have to get it out. You can't do this alone, unfortunately.
No, no. And it has to be, if you're not going to a professional, make sure it's someone that you can trust as well.
Exactly, yeah.
You know, it's just anybody off the street you're going to sit down with and start
rambling
on about,
Exactly,
what you're feeling. So some of the symptoms of stress, I was reading like a headache. I can understand that. Okay, that's a part of stress. What else would what's more symptoms?
So headaches are very common.
Yeah.
Upset stomach is a very common sign of stress.
Okay.
People can get quite physically ill from stress. Tiredness, oversleeping, undersleeping can be symptoms as well.
Oh, I can understand not having enough rest, but you can actually oversleep.
You can oversleep. If the stress becomes so intense that it moves into the realm of depression, then that can lead you to oversleeping, because the world might seem so overwhelming because of the stress that you just don't have the strength to be able to get out of bed and to face the day. So you kind of hide away in bed, hoping the problem goes away, and invariably it does not go away, and just that compounds it even worse, unfortunately.
Oh, jeepers.
So talking about it is really important, so you don't end up going in those cycles of oversleeping, undersleeping, overeating, undereating as well. A lot of people eat.
That's right.
Self-soothe.
Yes.
You had a bad day at work, you might have some chocolate cake or whatever, then you might feel bad about yourself.
Why did you say chocolate?
I don't have any with me, so I'm sorry.
That too.
Chocolate is a big one, yeah. But even substances, alcohol, a lot of people turn to alcohol when they're stressed, and then they have the initial stress that they chose the alcohol for, and then they have the problems that come along with the alcohol added on to that. So a lot of our solutions aren't really solutions at all. They just kind of prolong the problem. So that's why it's really important to talk to a professional. Even if you're not debilitated, you're not missing work, but you're feeling, I'm not quite at my best, talk to someone. It's going to help.
Yeah, no, I really do understand that. So can we manage stress? How?
So one of the best ways to manage stress is to be proactive about it. Once you're already stressed, it's tough to get out of it. Exercise is huge. If you can exercise even 20 minutes a day, it doesn't even have to be like just going for a walk is good enough. Sleeping right, eating right, talking to someone, having good relationships, having people in your life who you can confide in, having work, managers and colleagues at work you can turn to. All those things kind of work together to decrease stress. But it really is about preventing it before it happens is the best way to go about it.
So things like alcohol, stay away from that, stay away from substances, anything that is negatively going to affect you, stay away from that.
Exactly. If you can, stay away from alcohol. Alcohol is going to make your stress. Alcohol is tricky because in the short term it makes you feel better, but in the long term it makes you feel 10 times worse. So you get that immediate gratification, but the long-term consequences aren't really worth it. Cigarettes or another one, vaping. A lot of people will use nicotine when they're stressed. Then become addicted to nicotine, and the problems arise with that as well. So any kind of mind-altering substance, it's not a game you're going to win. The substance always wins in the end. So try to avoid that if you can.
So can stress be a motivator?
It can be for some people. It can go in two ways. Stress can either be kind of incapacitating, where you can't get to the next stage, or other people view it as, I'm so stressed out about money, about X, Y, and Z, that I'm gonna take out a loan and go back to school and start a new career. So it can motivate people. I think for most people it probably does the opposite, though. It kind of paralyzes people.
Okay.
Yeah.
Alrighty. Anything else that you want to tell our viewers about stress and stress management?
Yeah, I think it's just really important to talk about it, to be open about it. The conversations are easier to have these days, as mental health stigma lessens. So
Yes.
keep talking and reach out to us. Go to accessmha.ca to check out our programs, and we'll do what we can to help.
Awesome. We're very fortunate to have you people so close to us.
Thanks,
being
Doreen.
right here in Brockville. So thank you, Chris. Don't go away. We'll be right back with more.